While conditions such as kidney disease, kidney stones, and kidney failure have names, for the most part kidney disease and other kidney health problems are a mystery to medical communities. Researchers are not yet aware of the true cause of kidney-related illnesses. The following video demonstrates what is really behind various kidney issues and the steps to begin healing. Medical research has yet to look fully into the true causes of kidney disease. When someone's kidneys start failing and there wasn't a blatant physical injury, medical doctors have no answer for their patients as to what the cause is. They may put the blame incorrectly on the patient's genes because this is what they have learned from misguided theories and agendas in medical science and research. Sadly, putting the blame on the patient's genes often leaves them feeling helpless, discouraged, and let down by their body. No patient should be told their genes created their illness because it's simply not true. Genetics are not the cause of chronic illnesses, despite the fact that medical science and research and medical and alternative health communities are saying they are. This is misinformation driven by funding, and it's critical that you and your loved ones know that your genes are not to blame for your symptoms and illnesses. Modern medicine says the causes of kidney disease are either high blood pressure, diabetes, or injury. Certainly high blood pressure and diabetes are not ideal environments for the kidneys, and of course these are things you want to do your best to avoid. However, those are not the reasons kidney disease exists. The injury explanation is an obvious one and absolutely can be the cause of kidney failure. If someone's kidney has been ruptured either by being in a fight, a car accident, or some other sort of incident, that organ will be weakened and lead to problems that can be critical either in the moment of the injury or many years later. There is another form of injury that is often looked over, though. And that is injury from medication. Whether someone is addicted to prescribed medication and taking it recreationally, or they must rely on it for a chronic condition, medication can be harmful for the kidneys. I understand that some people must take medication because they aren't given any other option, and it can be helpful in some cases. However, when it comes to kidney health, it's important to consult with your physician about avoiding or lowering medication that's not prescribed for your kidneys and that may not be as important for you, so you can lighten the burden on your kidneys. Oftentimes, people are over-medicated from going to multiple doctors who each prescribe more medications. You can ask your physician which medications are least important so you can assess together which ones you may be able to lower or stop to help protect your kidneys. What do our kidneys do? The kidneys are essentially a filtration system. The liver first processes toxins and then passes them along to the kidneys and intestinal tract for elimination. The kidneys gather these processed poisons and moves them into the bladder, where the toxins can then be excreted out of the system. Another way to look at the kidneys is as poison-gathering containment systems. The kidneys do more than just filter poisons, so the filtration process isn't as thorough as you might think. The kidneys have a thick skin on the outside and the inside, so they are able to handle and hold a decent amount of poison, keeping it from harming you in other areas of the body. The HHV6, human herpes virus 6, was discovered in the mid-1980s. And then soon after they discovered HHV7. Unfortunately, funding was cut off at this point and no further viruses of its kind were studied appropriately or discovered. It's unknown to medical science and research that HHV6 and HHV7 are directly responsible for many varieties of kidney disease. If the kidneys are containment systems for toxins, you can look at them like barrels of crude oil. With any container of crude oil, there is a thick layer of sludge at the bottom. The sludge is concentrated and as thick as molasses. Over time, as the kidney gathers and collects, the sludge can harden and produce kidney stones. The difference between kidneys that produce stones and those that do not depends on what exactly the kidneys are gathering and collecting. Kidney stones are created from excess protein in the diet, and even too much calcium, which I will discuss further in the following sections. We have been told our whole lives that protein is one of the most important macronutrients to focus on. Unfortunately, this has led to a society obsessed with protein in all forms, especially in the form of animal products. While protein has a role in our diets, most people these days consume far too much protein, as well as too much fat. High levels of protein are especially harmful for someone with kidney disease because it exhausts the kidneys and makes them weaker. The more protein a person eats, the more the kidneys have to work and struggle to filter out poisons. Burdening the kidney with excess protein and fat only allows a kidney virus such as HHV6 to continue pursuing its quest for kidney disease. Since lowering your levels of protein is very helpful for recovery from kidney disease, try minimizing your protein while still making sure you are consuming enough calories and bringing in more healing fruits, leafy greens, and vegetables. Great sources of calories include foods like potatoes, sweet potatoes, winter squashes, bananas, mangoes, orange juice, figs, melons, apples, pears, quinoa, millet, black beans, and more. No matter what kind of diet you like to follow, whether it's high in animal protein, vegan, or vegetarian, try to decrease the amount of protein you consume if you have kidney disease. This does not mean you need to stop eating animal products altogether, but try not to eat animal proteins 3 times a day. Instead, eat it once a day while increasing the foods I mentioned. If you're a vegetarian, it's helpful to stay away from too many nuts, and cutting out soy, dairy, and eggs entirely is extremely helpful for healing. If you eat a vegan diet, it's helpful to stay away from high-protein powders, too many nuts, and soy products. If you are in a region of the world or have a cultural diet that consumes a lot of animal protein, you can try to just decrease your portion and increase your fruits, leafy greens, and vegetables whenever you can. Once you can minimize heavy levels of protein in your diet, you should start to see improvements in your kidneys. Keep in mind there is an abundance of bioavailable protein in most fruits, leafy greens, and vegetables. Bringing in some straight cucumber juice and straight celery juice every day can be very helpful for kidney health. It can also be helpful to consume berries and apples on a regular basis. A little bit of melon can help flush out the kidneys too. If you or a loved one already has kidney disease or is on dialysis, too much potassium can be hard on the kidneys. So it's best not to eat too many of the fruits that are very high in potassium such as bananas, avocados, and figs. If you suspect you might have weakened kidney function or you want to prevent kidney disease, it's fine to eat these foods in higher quantities. Other foods that are helpful for the kidneys are lettuces, varieties of squash, and sweet potatoes. Drinking lemon water can be helpful as it flushes out toxins and supports the kidneys. Avoiding diuretics, such as tea and coffee, can be helpful, as well. However, a little bit of herbal tea like lemon balm, peppermint, and nettle are safe to consume. It would be helpful to stay away from dairy products as these feed viruses. And eggs feed the HHV6 family in particular, so it would be safer to consume half of a steamed potato instead of an egg. Talk to your doctor about some gentle antivirals you can take, such as lemon balm tincture, nettle tincture and L-lysine. Lysine is great to combat HHV6 and HHV7. Barley grass juice extract powder is also helpful for the kidneys because it has mild antiviral properties. Be sure to communicate with your doctor about antiviral supplements as the herbs may conflict with any medications you are taking. Thank you for watching the video. Please subscribe to our YouTube channel.